Hi, everybody. Welcome back to the podcast. I'm excited. Dr. Caroline Leaf is here. Hello.
Hi,
Welcome.
it's so nice to be with you today. Thank you.
Yes, I'm very excited to talk with you. As we were talking right before I hit record, I have quite the goodie bag of, addiction, trauma, eating disorders, like what have you. And you said something that was really impactful. You said that is sort of the spectrum of human reactions, I think is what you said. Now, if I quoted you wrong, of course, correct me. But that's where I want to jump off. Like, a lot of your work is about normalizing what we have been taught or what society has sort of said, oh, let's not talk about that. And your work is about bringing it into the light.
Absolutely. So I approach it from, and you summarized it really well. I approach mind from a very different angle. I try not to talk about mental illness. And when I say not talk about it, I try and help people to understand in a better frame. So I come from a cognitive neuroscientific and communication pathology angle, which is a big fancy way of saying I look at mind, brain, body, or psychoneurobiology. So my 38 years that I've been in the field, I've been in clinical practice for 25. I don't practice anymore. I've done clinical research for 38 years. I still do it. The book has got some of my clinical trials in. And I've tried to look at this from an angle of what are we as what does it mean to be human, and what does it mean to be a human in the adverse and happy experiences of life? So every human, whether we like it or not, we're going to suffer trauma, we're going to suffer adverse circumstances, because it's not a perfect world. We can't control people, we can't control events and circumstances, and those are the facts that have been the facts from day one, whatever day one was and wherever it was. So basically, we've always, as humans, battled, and we battle with our mind, and our mind is not the same as our brain and our body, but our mind uses our brain and our body. So our brain and our body get impacted by whatever we're experiencing with our mind, because our mind, brain, and body work together to express who we are as a human. So
I want to pause there for a second, because I've never heard the separation of mind and brain.
And you represent, I'm so glad you brought that up, because you represent, your statement, I should say, represents the outcome of the current narrative, which has been dominant for 40 years, around about 38, 40 years. So in the 80s and before, mind and brain were seen as separate, but brain was seen as inflexible. So right from ancient times up until about, honestly, 40 years ago, mind and brain there's always been the debate, but pretty much were seen as two separate things. And then as neuroscience advanced, so we became very neurocentric. We became very focused around the brain. And suddenly brain and mind were subsumed. And the way that they speak about it, the one group of scientists, is that the brain produces the mind. But the brain can't produce the mind, because the brain can't do anything without us. And who's us? That's you and me, our mind. Because the difference between you and me and a dead person is our mind. A dead person couldn't do anything. We are listening to each other. We're communicating. We're conversing. People are listening. You are, all kinds of thoughts and memories are coming up. You are responding. You're having an experience. I'm having an experience. And how am I having it? How are you having it with your mind? So your mind is an energetic force on a physics level. On a psychological level, it is your ability to process what you experience. And when we talk about processing, we're talking about how we think and feel and choose about what we're experiencing. So as a human, we've done that from a certain point in the womb to the age we are today, and we'll continue till we die. So every time we wake up, between the time we wake up and go to sleep, we are actually converting all our experiences through our mind into our brain and our body, and they become physical substance in our brain and body. But the mind is doing the work. If your brain is dead, nothing happens. So the brain can't change itself. Genes aren't what we call self-emergent, nor is the brain. They can't do anything without you and I. So it's our energy forces, our humanity, our aliveness that is the driving force. And my whole philosophy, scientific research, clinical application, and I've worked with extreme cases, traumatic brain injuries, Alzheimer's, dementias, autism, severe war trauma. I worked in South Africa, I worked in Rwanda, I worked in apartheid South Africa, I've worked everywhere. I've been in the midst of different situations, culturally, socioeconomically, with the whole purpose of studying what is mind, what is brain, what is body, what is the connection, who are we, what kind of level of power do we have? And what does it mean to be depressed or anxious? And do we have any kind of way of managing that besides getting a label and drug? And what does it mean when people are addicted? Is it a disease? Now, you mentioned that there's alcohol addiction in your family and there's bipolar, which is what you've been told. And you've seen that.
Right.
It doesn't mean that is something that is who you are. It is something that people have responded to adverse circumstances. It passes through the DNA as an epigenetic factor, but it's not part of your core being. It's part of what's come through. So when things pass down through generations, and it's a very interesting concept, it's not that that's who you are, it's what's happened to you. And the whole thing is, you are at your core an amazing, brilliant, beautiful, phenomenal, wired for love, outstanding human being who happens to have experienced a lot of adverse circumstances and whose family have experienced as every other human on this planet to different degrees. And so when we look at it like that, we are all in this game together and we're all experiencing different experiences together. And yours is not the same as mine, but it's still different adverse experiences, and we respond and we react. We can't change what's happened to us, but we can change what's in us. And that's the
what I hear. What I hear when you're saying all this is the distinction between who we are, our core being, and circumstances that happen to us.
Exactly. And who we are is our mind. That's our mind. It's this, and we can explain it on a physics level. I mean, I can go into tremendous depth, which I won't, but I explain a lot of it. But just generally, like the easiest way to understand mind is to think of a dead person and then a live person. You and I do. I can put an EEG on your brain. I can put a EKG on your heart, and you would see response. But a dead person, there would be no response. And fMRI would see changes happening in your brain. We wouldn't see that on a dead person. So that difference, that aliveness, is your mind, and your mind does stuff. And it creates stuff. And your mind is how when I say your mind does stuff, your mind is enabling you to be able to think and feel and choose in response to what you're hearing and seeing. And we do that all day long. We've been doing that since we were in the womb, and we'll do it till we die. And that is mind. So mind on a psychological level, on a physics level. So if you use things, it's an electromagnetic force. It's a gravitational field. We float, not floating now, you and I, we are sitting because of gravitational fields. But not only are we surrounded and immersed in gravitational fields, we have our own unique gravitational field. So you have around and through you an electromagnetic and gravitational field that is generating photons that is completely unique to you. And I have my own. I can't have yours, you can't have mine. When you die, that goes. When I die, that goes. That's the physicsy side, the energy side of mind. And that's what is actually empowering the brain to respond and to change, and empowering the body to do what it does. We make 1 million new cells every second. It's our mind that's driving that process. The minute you die, there aren't 1 million new cells being made anymore. So if you think of it like that, it's your driving force. And the whole thing then, if that's your driving force, how can we define it? What does it look like? What can I do with it? Can I manage it? So I teach mind management. So once you understand what mind is and the relationship between mind, brain, body, then you can manage the process, and that's filled with hope. Then suddenly you're not mentally ill. You're not a broken brain. You're not a basket case. You're not crazy. You're just suffering from adverse circumstances. And it's worse at certain periods of your life when certain things happen, because things accumulate and we collapse. And that is okay. It's okay to be messy. We just have to know how to understand that and manage it. And so do the people around us. That's the message I'm bringing. And it's not the message that the current mental health system brings at all. It's very different.
Right. When you were talking about the electromagnetic field that we all have, I thought of, the first thing that came to mind was, how do I trade my field for someone else's? Number two, what color is it?
You can control it. You can redesign it. That's the beauty.
And I knew you'd say that, but what color is it? And then the third thing I thought was, my son tends to, when he's cold, he'll get this big blanket and he'll wrap it around him, and he will just wander around the house with it. He'll go upstairs, downstairs, and I keep telling him, can you please not take the blanket on the stairs? Because I just see, this electromagnetic field of blanket, tumbling down the stairs. But it's interesting. Those were the three things I thought about. What if I don't want my field? What color is it? And, is that the thing that's tripping me up and down the stairs?
It's your thing that's keeping you going. But what we messy. What we have, and this really makes it easy to understand. We have a messy mind and we have a wise mind. And I mean, I'm giving a simple kind of concept because it's very deep stuff. But the messy mind is totally normal. It's part of our psycho-neurobiology, psycho-mind, neuro-brain, biology, body. Okay, so it's part of who we are. It's how we do life. Like we don't know what's coming up in the next moment. So it's all experimental. And sometimes we understand, sometimes we don't. Sometimes we say the wrong thing, sometimes we say the right thing. Sometimes a bad thing happens and sometimes a good thing happens. So all of that's kind of messy. But in the messiness, when we manage the messiness, which is getting the wise mind to talk to the messy mind, then what we're doing is we are moving into a state of growth and repair. Or repair and growth. And that is what we're designed to do as humans. Humans are set up to be experimenters, to make a mess with their messy mind, because we experiment with our mind. Our mind's doing all the action. And then we are designed to experiment, which means you hypothesize, which means that sometimes it works and sometimes it doesn't. And if it doesn't, then we must go in and fix it. And then we must grow from that. And then and that's how we organically develop. And our identity is what drives that, and our identity grows. And so at the core of who we are, we talk about in neurobiology being wired for love, because we don't have any structures in our cells, in our systems, in our brain, and that are wired for toxicity. But what we are wired for is to make a mess and fix it. But we're not wired to stay in a mess. And so when we stay in a mess, our entire brain, body, and our energetic field, which is our mind, I think he'll choose, becomes very disturbed, because it's disturbed in the sense that balance has been, there's an imbalance. The homeostasis of the body has been disturbed. And then that threatens survival. So then we have all these signals that come from our body physically, from our brain, through the neurons, through the thought trees that build in our brain, which I'll show you pictures of, and then through our mind. And all of it's about restoring balance. And the easiest way to understand this is to think of the COVID virus. We've had so much immersion in the concept of the COVID virus that we understand that it's a protein, an abnormal protein that's attached to this virus, and that our immune system responds to try and fight it. Now, we all understand. I don't think there's anyone on the planet who doesn't understand that our immune system is there to fight a virus, to protect us.
Right.
But what most people don't realize is that a toxic experience is also a protein structure. So as you are listening to me now, you are building my words with your mind into your brain as a thought tree. It literally looks like a tree. You're growing a tree at the moment. All the listeners are growing trees at the moment of this discussion. And these trees are made of proteins. And like a tree has got a root system and a branch system. So the thought trees in your brain have root systems and branch systems. These are memories. So we, with our mind, grow our experiences into thought trees made of memories. The memories are all the details, the data, the feelings, the emotions, the choices, the stuff of the thought tree. And so everything I'm saying is in the root system, which is the source. So as you started the podcast, you introduced me, you sowed a seed, you dropped the seed in the ground. As we started our conversation, everything I'm saying and you asking me and me discussing is going into the root system. And then you, with your unique way that you think, feel, and choose, your unique identity, you interpreting this information in your own way and building that. So you're building a parallel, literally a parallel to that, but it's your interpretation of. And then this is then how you would go from this conversation and show up. This is the information you draw from. So the fact that I'm talking about all this stuff, I have lots of these built in my brain about mind-brain science, and I'm teaching from those. So I spend time building them into my brain, and now I'm talking from them. So everything we do has gone from the outside to the inside, and then it produces what we say and what we do. Now we understand, and that's all mind, brain, body. So if we have an adverse experience, like you had a lot of childhood trauma, so you had a lot of toxic experiences. Now that
looks like my tree. That's what my brain looks like.
We all have these. So there you go. These are actually made of protein. So like the COVID virus, let me start with that COVID virus again. It's made of protein. When you take this experience, this discussion, and you build this into your brain, these little branches are made of protein. So as my words hit you and you push those words into your brain as an energy force, that creates an electromagnetic and genetic response and chemical response in your brain. And the result is that proteins are made. And those proteins are holding my words as vibrations. And the more I say, the more branches you grow to hold the words. So you're literally growing branches as I'm speaking to hold this content, which is phenomenal. So it's a protein structure. This is healthy, so your immune system's happy. Now here's your life toxic experience. I don't know what happened, but one toxic experience after another. Now that's a protein structure, but it's abnormal. So the energy wave that comes in from the abuse or whatever happened to you, and I'm very sorry what you went through, that is traumatic. So that protein that forms as a result of the experience going from your mind into your brain is abnormal. It folds abnormally. So the vibration is abnormal because it's not what you should be experiencing. It's not what you as a human should have experienced. So it's a distortion of the truth. That then this is your interpretation of that. I'm this, I'm bad, I'm shame, I'm useless, I'm broken, I'm whatever your choice, what you thought about life, you can't trust people, whatever happened, your interpretation of that's the event, that's your interpretation, and they grow simultaneously. Now that is toxic. So your immune system says, hey, that shouldn't be there. That's a threat to survival. That goes against your wide for love of nature, your optimism bias. So let's send out T lymphocytes and B lymphocytes and macrophages, exactly like it was a COVID protein, to go fight this, which is because it's trying to get rid of that. So that then activates a whole downward cascade through your entire body. And now your body starts reacting. So you get GI symptoms or cardiovascular symptoms or hypertension or whatever. So our body's saying, hey, there's something going on. And our mind is like getting consumed by these details, but we can't process them because they're too painful. So then we start having a signal that says, okay, well, I've got to get you to pay attention. Mind has got to get mind to pay attention. So your mind grabs your attention by sending signals of depression and anxiety and disassociation and hallucinations, whatever, down from one bipolar to the whole gamut. And you'll have a selection combination, different degrees of severity, depending on how suppressed, how traumatic, how etc., etc., etc. But those are not diseases. Those are not symptoms of a broken brain. They are your body telling you there's a problem. You need to pay attention. They become warning signals as opposed to symptoms of a disease. They become warning signals of an issue that you need to go and fix up, that you need to go and embrace, process, and reconceptualize. And that's what we need to be listening to, as opposed to, oh, you have clinical depression, you have a disease of addiction. Addiction is not a disease. Addiction is a coping mechanism. It's what there's a relationship between the person suffering and the substance of choice or whatever it is that's being used. It could be exercise or whatever. We know it could be anything. It doesn't mean that your brain is wired for the disease. It means that you can't cope with this. And to suppress it, keep it dealt with, you do the addictive behavior, the alcohol, whatever it may be, because it's too hard. So, it's, as long as you get labeled as an addict, so now you've had this adverse stuff, you've gone through all this terrible stuff. So you're trying your best to do your best, which is, okay, I can't handle this, I'll do the alcohol. So it's not that you are being, it's not a being, it's a doing. You're doing the alcohol. It's not who you are. It's a totally different concept. So what should we be doing? We shouldn't be telling you, hey, you're on top of that you're a broken brain, that you're a diseased person, that you're a crazy person, that you've got this That's terrible. That invalidates you, your experience, your history, and it doesn't help you process it at all. It just is going to make you feel worse about yourself. Maybe initially, okay, well, I've got addiction, I've got a disease. Maybe initially it gave you a sense of hope, but then what? It's empty. It's an empty promise. So we have to rather go back and become thought detectives with the support of therapy and on our own, because you're not in therapy 24/7. You live with yourself 24/7. Your mind is active 24/7. Even when you're sleeping, your mind is working. So we have to know how to manage our mind between the therapy, between the counseling, between the support systems, and also in the support system. And that's where my work, what I've done over these years, is to look at how do we do that? How can I start paying attention to those warning signals, embrace them to find the message, see them as helpful messengers. They're scary, they're horrible, they're frightening, they're horrific, and see them though as telling me, I've got to see, what am I thinking about myself? What's the data? Why? And how can I change this? It's happened to me, but I don't want it in me like this. How can I change this to this? In other words, how can I reconceptualize what's happened to me? And because it's happened to what's in me. And that is the power that we have. And that's what I teach. That's honestly a big picture walkthrough. And it's not easy, but it works. It's science and it works. And it's
wonderful. So anyone listening to the podcast, I will have the video of this up on YouTube and on Instagram, so you can see what Dr. Leaf was talking about. When she was talking about the healthy brain, there was a nice green, fluffy, beautiful tree, and then the, you know, other brain was dark and something out of like The Nightmare Before Christmas.
Something out of Game of Thrones, or like Lord of the Rings or something, you know, something
right.
scary. It's just a wiry tree all the way from South Africa, by the way, but it just really represents, because thoughts look like trees.
Right.
So that's why I use this.
Right.
So yeah, I always do normally tell people what I'm, so thank you for doing that. Normally
No,
I do.
no,
People, if you're listening, I'm holding up this. If you're listening, and I'm holding up so there's a brain and a skull that I'm holding up as well, and we can change that brain. And that's the message of hope that I bring, is that it's really hard. I'm not saying it's easy. I mean, you know yourself, you've done the work. When you start looking at the pain, it's horrific. People get worse before they get better, and sometimes you can get worse for months. But that's okay. If you've got a system in place that you know how to drive the neuroplasticity of your brain, it's really helpful. And that's pretty much what I bring to the table.
Well, and one of the things that really hit home for me was when you were talking about how the thoughts can show up as inflammation or sickness or pain in your body, right? And so all this process I've worked through there for a long time, I had terrible neck and back pain. I was in a car accident, but it was beyond that. And as I went through and worked through the trauma and getting sober, like my neck stopped hurting, my back stopped hurting, all like my allergies improved. Now, I think a lot of it is I take better care of myself too, but it's the whole connection that I know me personally was broken. But listening to you tell it, it was was it me, my body protecting, my mind protecting myself? Like what was going on there?
It was basically the fact that these years and years of trauma is sending shockwaves through your brain and your body. So think of what we're supposed to be having is like these love waves. You literally, in quantum physics, you can literally, and electromagnetics, you can literally track the waves of the gravitational fields of when an environment is healthy and when it's not healthy, when your mind is healthy, when it's not healthy. We pick that up. Like, for example, when I use a QEEG, we can see when someone's highly anxious. The brain waves, there's 6 different types, and they're supposed to be all balanced like the waves of the sea, when waves are like doing what they're supposed to do, but they become like a tsunami. And so in other words, when we are in a state of constant stress or chronic stress, or having extreme trauma states and suppression of that, when maybe the trauma's passed by for a period and then there's suppression, anything that's thrown us off, your body that's a toxic shock. That's the immune system responds, the brain waves go crazy. So the immune system sends out inflammatory factors. But if it doesn't, the whole point of the immune system is to go and create an inflammatory reaction around there so that healing can happen, and then inflammation goes away. So it sends out the soldiers. There's a war and there's bleeding and whatever, and then the soldiers go away when it's beaten. But if this doesn't go away, then there's an autoimmune response. So the inflammation that's supposed to go doesn't go, and then that affects the other systems of the body, and then that right down to the level of the individual cells. So some of the work that I look at is looking at telomeres, and this is so interesting because it's quite new research. And telomeres are if you think of your DNA, the ladder of the DNA, and if you think of a chromosome, if you pull a chromosome out, it looks like a little X. So if you cross your fingers, for those that are listening, cross your fingers and look at your fingernails. Your fingernails would be, the crossed fingers are a chromosome, and the little fingernails would be telomeres. And telomeres are what we would call a proxy for mind management. In other words, they are driven by how you are managing your mind. In other words, what's going on in your life and how you're responding. So if you have a lot of chronic stress and the chronic trauma and you're just not managing it, those telomeres become very weak. Why are they important? Well, you make about 1 million cells plus every second. And those cells are then forming every organ of your body and all the systems of your body. So you keep replacing yourself. And that's driven by your mind. A dead person doesn't do that. A live person does that. So your mind is doing this. If your mind is very messy and it's unmanaged, then all the energy, the gravitational fields are thrown off, the electromagnetic forces are thrown off. This is Einstein's work. This is this is basic physics. It's thrown off. So we don't have a nice wave. We have all these disruptions in our mind, which then go through our brain and our body, and it's shock systems through our brain and our body. And we have all this build-up in the immune system response, and our telomeres then become weaker and weaker. And the cells that we now make are not as healthy. And those cells make up your heart and your lungs and your skin and your everything in your brain. And so over time, cumulatively, the chronic stress state, the chronic trauma increases the vulnerability of the entire brain and body to disease. So, for example, I have a case study in the book, a couple of case studies of our recent clinical trial. And at the beginning of the study, some of the subjects had their ages were, let's say, for example, in their mid-30s, but they had bodies, their body age, their cell age, their health of their physical body was of a sickly 65, 70-year-old. So if you are in your 30s, but your body is a sickly 65, 70-year-old, your vulnerability to disease has increased. So we see a trend that has occurred over the last 40 years, a frightening trend that was picked up in 96, and it's been very strongly identified, and it's been spoken about, not enough, but more. And it's called the deaths of despair trend. And what it is that for years, people have been living longer because of the advances in medicine and technology. But that trend actually started reversing in 1996, and it's pretty much in reversal now. In other words, what that means is that people are dying 8 to 25 years younger from preventable lifestyle diseases in this modern day and age. In 2021, people are dying 8 to 25 years younger than they should from preventable lifestyle issues and diseases. And what does that mean? People are dying from cardiovascular issues that they shouldn't. So if you're 30 and your body's a sickly 65-year-old and you're not being able to manage your chronic stress, and you've been given drugs like antidepressants, which add to your cardiovascular load and you'll increase your chance of stroke and increase your chance of 3,000 other things, literally weakening your body, and you've now got because of the inflammation in your body, you don't have enough serotonin in your gut, and you've got inflammation in your gut, so now you develop leaky gut syndrome, and then this happens, and then whatever, and you just have this storm, one thing after another, allergies, and the back pain, and all of these. Wherever there's a weakness in your family line, that tends to be the area where that gets hit first. And then over time, things get worse and worse. Like our family has major GI issues. So if any of us are stressed, our GI system just go crazy. So in other words, that is our body trying to deal with this bombardment of toxicity and the suppressed thoughts and so on. And then it's also our body saying, hey, listen, I'm going to send you very loud warning signals so that you can be a thought detector, so that you can go and fix this and reconceptualize it so that we can restore our survival health again. So it's that whole combination. And that's psychoneurobiology. What I've just described is the whole sort of cycle of psychoneurobiology. And we can control it hard. We need medicine to support us. We need therapy to support. We need coaching. We need friends. We need support. We need honesty. We need to stop hiding behind labels and stigmatizing people. And more and more people like yourself are talking about what you're going through and what you're going through. But there's not one person. I've experienced it. Every single person has experienced depression, anxiety. We need to tell people that this is okay. Only 3% of leaders talk about depression, and I'm talking about every sphere, whether it's government, corporates, education, churches, and that's terrible, because 100% of people are battling with mental health issues to varying degrees at different stages of their life. And suicides will increase and will continue to increase until we allow people to process their pain openly without being judged, until we teach our kids that, hey, if you're feeling sad, it's okay. And we don't invalidate their feelings. You probably had all your feelings and all your emotions invalidated. You were never allowed to process. And until we shift those sort of parameters, we're going to have a continuing rise of people dying younger, people committing suicide, younger and younger and younger. So that's
I think with like generational, I know with, my generation and my parents' generation, children were seen and not heard, so our emotions were not valid, right? It was, I remember my parents used to always tell me to lose my attitude.
Yeah.
Lose your attitude. And I'm like, well, I'm pissed off. Internally, I'm like, well, I'm mad. There was no room for that. There was too much. The adult emotions were too big and too important, right? And I was an only child, but I know my friends too, like all of our emotions were just not valid. It didn't matter what we thought or felt, right?
And then you grew into an adult with never having been able to process your emotions. And
so I drank.
Exactly. Meanwhile, what we should be telling our kids when they come home and they're crying, you should never say, change your attitude, or that's not so bad, or don't be big, grow up, be a big boy, be strong. We should be saying, hey, listen, I don't know what you're going through, but do you want to tell me? And when they tell you this whole thing, I'm so sorry, that's terrible. And
Right.
how can I help you? And, let's talk about this. Never to say, oh, that's not so bad. You should hear what happened to me. Or look at how lucky you are. Look at how much you've got. This is the worst thing we can do to our kids. And then also for ourselves. I mean, you talk about your emotions in your family, the adult emotions were too big. But did they hide behind closed doors? Did they process them, or did they just get stuck in them? We should be saying to our kids, hey, listen, I really feel sad today. I feel depressed today. This is the reason why. This is what I'm doing. So you tell a child, oh, okay, it's all right as an adult to battle. And my mom's got it under control. She's actually explaining to me why it's not me, because a child will immediately think, oh, what have I done if mom's cross?
Right.
If he gets upset, what have I done? Even as an adult child will react like that. So we've got to really watch our emotions and talk about them. Tell your adult children. I've got 4 adult children. If I'm having a day where it's just too much for me, I say, listen, guys, I can't be there for you in the way you want me to be there today, because I just need a bit of time to process, because this and this has happened. I'm feeling like this and this is what I'm doing. And the Neuro Cycle, which is in my book, I do it. I've taught my kids, my family, they've grown up with it. I'm honest about that so that we can give each other space to process. Then your child grows up. You teach this, our kids have been, this is from 3, I've been teaching my kids this, so they know how to process their emotions. Doesn't mean that they haven't had adverse circumstances, doesn't mean that they've had all kinds of challenges, because that's just life. But if we can kids, if we can equip ourselves, we can then be a healthier society in general, because we have a way of processing what is going to happen. Inevitably.
Wow. Oh my gosh. You said that we can't be with our therapist for 24 hours a day, but I want to be with you 24 hours a day because there's so much here. One thing I wrote down.
I have an app like having therapy. I have an app called the Neuro Cycle app that actually goes with the book that people can download on. That's the book. I think that's one that you've got that we're talking about.
Yeah.
My most recent
up your mental mess.
Everything I'm saying is in here, and my system I developed to actually help you manage your mind is in there, the Neuro Cycle. Then I have an app called the Neuro Cycle, and that's literally like me giving you therapy, and you can use.
Well, there you go.
And we're starting a whole Neuro Cycle lab where I'll be able to talk people through stuff, and so that's going to be very exciting.
Oh, that's exciting. That's exciting. I want to talk really quickly about self-sabotage. This is a theme that I think is really loud in my community, and I know with myself as well. Whether it's your exercise routine or I'm going to be disciplined and work on this project, and like whatever it is, how does it, maybe you start a goal and then you just self-sabotage, just throw a bomb in it. I call it throwing a grenade in my own life, like just pulling the pin out, throwing it out and being like, I don't know what happened. How do you define self-sabotage, and what can we do about it?
Basically, it's a great, I actually put up a post yesterday about this, and I'm just going to pull that post up because I actually made quite a good point. How to stop sabotaging yourself, literally. Okay, so 12 hours ago, I put that up. Okay, so basically, if Psych Today had put up a great post that I reposted, and then I just spoke about that. Sometimes we are our own worst enemy, and it's things like, basically, I said here, how often do you get in your own way? Are you aware of your particular self-sabotaging behavior? So what happens is that what we do is it's an identity crisis. It really is. It's an identity crisis where we think, where we've gone through something, we've created a patterned response, because this is the interpretation of that, and we're living out of this. But this is not healthy. That's healthy. So this is this produces our behaviors. So we experience something, we interpret that. This is all in our mind and brain, and then this then produces what we say and what we do. So whatever you're saying and whatever you're doing is a signal of this process. So self-sabotaging is just one of those other warning signals that we are, and that has been almost kind of mixed in as a way of coping, but it's not an effective coping mechanism, because it just makes us feel worse, and it doesn't take us forward. It keeps us going round and round the circle, and round that sort of negative cycle, and kind of grows us, because whatever you think about the most will grow. So essentially, we need to become we need to go through the process. We need to actually do a neurocycle. A neurocycle then is the way that we get the wise mind to talk to the messy mind to analyze, why am I doing this? Because of self-sabotaging behavior, whatever behavior you have, whether it's self-sabotaging, if it's a pattern, if it's a behavior pattern, whatever's a pattern is there for a reason. So there's something that's causing that, and you have to do the work to find that out. So it's never just one reason. The reason you self-sabotage and I perhaps are because all of us do it. We all, to a certain extent, is going to be different. Some of us get into a really bad place where we do a lot of it, and sometimes you only do it intermittently. But everyone's experienced a level of self-sabotage, whether it's on a very small scale or not. And the post that I put up yesterday, they said it was great. It was a repost that I put up, identifying and how to stop sabotaging yourself. Identify and understand the self-sabotaging pattern. And that was what I was saying. The first thing is there is a pattern. And so you can do a neurocycle. And the neurocycle, I can explain how to do this using the neurocycle, which is in the second half of this book. And it's in the app called Neurocycle. I assume you'll put up the links in the show notes.
Yes, of course.
Okay,
Yes.
so the neurocycle is a way, it's 38 years of research. It's not just a little simple thing. It's a system. It's not a technique. You can put techniques and you can do whatever you want in that. You can still use meditation and all the different therapy techniques. It's basically how you deliver, get the wise mind to talk to the messy mind, and how you get your mind, the wise mind, helping the messy mind to manage what's going on. And when you do that, you clean up all the energy, which then goes into the brain, and it changes how the brain is wiring itself. So you're directing the neuroplasticity. So it's a mind-directed neuroplastic technique. Neuroplasticity in the brain means changing the brain. So it's how you do that. So it's how you use your wise mind to fix the messy mind, which is what we said we want to do in the beginning, because we're designed to do that. So it's activating a very natural design. We naturally do this periodically, but we can sometimes we don't do it enough, and we've got to train ourselves to do it more often. What it means is that we see from neuroscience that you can do this every 10 seconds. So you literally are able to stand back and observe yourself and observe your patterns and the thinking, feeling, and choosing behind the patterns, and analyze those and break them down, deconstruct them and reconstruct them. And that's what the neurocycle helps you do. So you're almost distancing yourself from the situation. You're stepping out into your wise mind, and you're analyzing and helping the messy mind to do its thing. Kind of like a pilot and a co-pilot flying a plane is another nice way of it. I used to get my patients to put two chairs side by side, and then you sit in one, and you also in the other one. The one that's you can choose. I mean, the one that you're sitting in could be the wise mind, and then the empty seat's the you, that's the messy mind. And you use the pronoun you. You don't use I. You say, okay, how are you feeling today? So you're giving yourself therapy. You've got these self-sabotaging behaviors. So let's look at the pattern. Let's start working through. So you get into that mindset. It's you're sitting there, like in therapy, it's accepting, it's kind. We need to use kindness. We need to be accepting. We need to see the self-sabotaging behavior, not as something scary, but as a signal that is coming out. It's a behavioral signal pattern. It's a warning signal. It's a clue. You're like a detective. Think of yourself, okay, I'm Poirot, I'm a detective, I'm Sherlock Holmes. I'm going to use the self-sabotaging behavior as a useful message. It's telling me something. So, okay, let's look at the useful message. What is the pattern? And then you start breaking it down. So that's the setup for the neurocycle. Then the actual neurocycle is 5 steps. So the first thing you do is you gather awareness. So you gather awareness of the self-sabotaging pattern by gathering awareness of 4 elements. What are the emotional signals that are coming out of the sabotaging behavior? It's making me feel anxious, it's making me feel panicky, it's making me mad, it's making me feel terrible about myself. So you gather apples. If you go into an orchard and you pick the apples and you choose the apple, you pick it, you choose it, you select, you're in control. That's what gather means. Versus going into the orchard, going up to the first apple tree, bumping it, and all the apples fall on your head. That's how we often do it. We just let everything fall and we get totally overwhelmed. So we mustn't do that. You must stand back and be very selective. I want that apple. I want that apple today. Only handle dealing with that apple. I can't deal with any more apples. And that's fine. So you do what you can, because you're not supposed to do the neurocycle. You do the 5 steps every day, but you're not supposed to solve a problem in one day. You can't. It takes a full 63 days to wire this out and rewire it.
Wow.
That into a new behavior. So new behaviors take around about 9-week cycle, 63 days. It takes 21 days to find this, sort of get this out the ground, the whole thing, roots and all, and to redesign it into this. But it takes another 42 days to actually stabilize this into a habit so that your behavior changes. So you do a little bit every day. And when you've got major trauma like what you've been through, you're going to find one cycle, you're going to fix the one thing. And then you're going to come back in another 63 days and find another thing and find another thing. And then that's your life's work. It's a lifestyle. People are dying from preventable lifestyle issues. We've got to change our lifestyle. So here's a pattern that you get your lifestyle under control. So you get those telomeres and brain proteins and all the inflammation. You get that. This is all going to get that under control, because I showed that within 9 weeks of doing the Neuro Cycle daily, the telomeres got strong again. So the cell health got strong. So by the end of 9 weeks, my subject's biological age and chronological age matched, which is in 9 weeks.
Wow.
Really groundbreaking research, because it normally, up till now, we thought it took 5 years. We did it in 9 weeks with mind management, no drugs, no diet, no exercise. And not that I'm saying that you must exercise, but I'm just saying we just took one variable. Mind management's the most important. So you've got to get that in control first. I mean, your mind even controls your digestive system. So if you're eating a great organic, healthy, farm-to-table meal, but you're all worked up, you can lose up to 86% of the nutrition, because your mind's driving the process. So that's essentially, so you've got to bear that in mind. So our whole neurobiology starts changing when we do the neurocycle. It's very systematic. Each step that you do each day over the 15 to 45 minutes each day for 21 days, it's all systematic. It's all pushing the brain slowly in the right direction. You're not overwhelming and draining yourself. And then the last 42 days, phase 2, you just do step 5, which takes 7 minutes. So it's 5 steps for 15 to 45 minutes for 21 days. Then you do just step 5 for 42 days, just for a minute to 7 minutes. And then you start another cycle. And then you start it, and you just, every day you just commit to this. And as you do that, you're disciplining and training your wise mind to work with your messy mind. That then translates into the rest of your day. So automatically you start using the neurocycle for the quick things. So you're in a conversation, someone yells at you, you get upset, you overreact. You can quickly neurocycle, get yourself back under control, get your mind right, get your brain right, and then you control the situation so that your whole day isn't messed up. So it becomes a lifestyle. So it's a lifestyle of training. So that's essentially kind of the concept. So you'd gather awareness of the signals, and you'd gather awareness of the emotional signal. First apple, the second signal would be your behavior, what's happening in your body. What are you feeling? Heart palpitations, GI issues, back pain, shoulder pain, neck pain. You just start becoming aware. Maybe the first day you only say, okay, depression, back pain. You might only be 2 apples you pick. You then also look at things like your behaviors. Now we're going to start breaking it down. Sabotaging behaviors. What are they? What specifically do they look like? And some of the examples I gave were like, okay, that's more like general stuff. I don't want to talk about that. It's more, here it's more like consider the cost.
Well, you can use mine. Mine is like going to the pantry and emerging 10 minutes later and not knowing what happened.
So that's your behavior, going to the pantry and not knowing what's happened. Okay, that's great. You grab that. Now remember, you are being kind to yourself. So it's all okay. You can accept this is a mess we're going to repair and grow. So until we know what the mess looks like, how do we fix it? So you've got to keep telling yourself that. So it's totally okay. So there you go. You grab that behavior. You grab your perspective. What is your perspective around that? So there's 4 areas, and those are the signals. Then you go to reflect, and reflect is where you start really unpacking, ask, answer, discuss. Why did I go to the pantry and come back 10 minutes later? And why have I blamed? Why am I feeling that emotion? And you start asking, answering, discussing. You will not find the answers the first day. It's going to take you the full time. And you may only find part of the answers in 21 days. That's okay. You'll come back and start again. There's no cookie cutter rule. The only thing is the system works in these cycles, because that's how you rewire the brain. That's how you discipline the mind brain interaction to work together, how you stop the mind ruminating and going down its own track and getting back into those patterns that you've wired in, that you've done for so long, that you'll be breaking those. So it takes cycles of 63 days to break and rewire. But how many cycles? I mean, I've had some patients that would spend 2 years working through extensive trauma. And then that's around that sort of main area. And then that would trigger another whole bunch. They're still years later doing it. Exactly. So and then there's new traumas. You've got kids. Let me tell you, you're going to have trauma from your kids. They're going to do things that you are going to freak out about it. It's in maybe small, maybe big. Life happens. COVID. We need to be prepared. We need to have a system in place where we know how to manage what we're going through. Doesn't mean you're not going to cry anymore. You are going to cry. You are going to be sad. All of those are normal. They're totally normal. The thing is to accept them as normal and then process them. And that's what the neurocycle helps you to do. So you go from reflect, then the 3rd and 4th step are right steps, very specific writing things that you do. And the 5th step is a little action step. I mean, it's in detail in the book and the app. But it's basically a system. And once you get in it, it's automatic. I do it all the time. And I showed with my research that you can get things like anxiety, depression, sabotaging behaviors, all these kinds of things under control by 81%. Minimum. Just 10%.
Wow.
Just 10% will change.
Oh, yeah.
81% 100% means that you pretty much can go through life with a sense of peace. And as things hit you, you'll bounce back up quicker. You'll get out of things quicker. Things that maybe affected you for 10 hours over the day. Like I used to get so affected by someone upset me. I just couldn't, it would just affect everything. Someone said something negative to me. And now if someone says something negative, I manage that within a few minutes. I've got it under control. The sense of peace that it brings you, and the sense of creativity when you recognize, hey, that's not who I am. That's what's happened to me. That's a doing. It's not a being. That's the shift that happens. So you become a person, and as soon as you become that kind of person, all of your love just flows on other people, and then you automatically want to help people do the same thing. So it kind of has this really great effect.
Yeah, I'm going to run, not walk, when we get off this call and get your book, because what you said, something happens and it impacts you all day. I have done a ton of work, and I can say, oh, I made such great progress, but I can get like where I've set a boundary and someone does not abide by it, and then I don't hold the boundary and I back off of it. That will send me into a spiral for hours and hours and hours. Now, it used to probably be weeks, and then I would go to the pantry and then that was sent. So I'm very aware, I'm at that awareness stage, but I haven't rewired. And so everything you were saying really impacted me, because I see it. But my brain is still like black tree. It's like, well, let's do this. Yeah.
I'm so glad you said what you said, because what you've defined is what I would say the massive proportion of the population globally are battling with. And that is, even those that have done years of therapy, we are very good at creating awareness. We're pretty brilliant. And once we kind of face our stuff, we find the reason. So you know why you're doing that.
Mm-hmm.
But awareness is not enough. You need to go beyond awareness.
Right.
So that's what I teach with my stuff. It's beyond mindfulness. It's beyond meditation. Use the meditation, use the mindfulness, use all those things, breathing and all that stuff. They're fantastic. I teach them in my app and in my book, but those are only pure brain preparation. You have to go beyond. And that's where the Neuro Cycle, in those very deliberate 63-day cycles, is hard work. And a lot of people say, oh, that's too long, but there's no quick fix. You're going to
It's not too long. You're going to live anyway. You're going to be hanging out watching Netflix in 60 days. You might as well heal your trauma.
That's what I feel. I mean, your mind has never stopped. Your mind never stops. You go to bed with your mind, you dream with your mind, you wake up with your mind, you get dressed with your mind. You can live in a mess, or you can live in a managed mess. And I'd rather live in a managed mess, because that's what we will find our sense of peace and clarity in life. So that's what you're saying. You have to, exactly what you said. You've got the awareness. And I show in my book about the subjects that were in the control group, because it was a double-blind study. So some got the treatment, some didn't. And the ones that got, but they all got the same testing: psychological, blood, narrative. I mean, so they were very aware of their issues. The ones without treatment, without the Neuro Cycle, they got really bad. I mean, their telomeres shortened, their anxiety levels were like insane. Their QEEGs were, so obviously we gave them the treatment at 9 weeks, so that calmed them, it sorted things out, because we limited the time period to 9 weeks. But that just shows you, and there's a lot of research showing, awareness alone is not enough. Sometimes meditation and mindfulness brings up patterns, but if you don't know what to do with that, you get worse. And I have seen this so many times, and I've heard so many stories, and thousands of cases of people emailing me and DMing me, telling me that stuff. And I saw it in my own practice with patients that came to me, had therapy for years, that were a mess, because they were so aware, but they were just like stuck in this awareness. You've got to go
right.
You have to deconstruct and reconstruct, and you can't suppress this. You can't just CBT it away, and that's been another bad thing. You can't just have a little magic trick and now I'm going to put that on there. That's a band-aid on a bullet wound. You have to deconstruct this. You have to make this work for you. It has to become, the toxic tree has to turn into this. It doesn't mean my story's gone, but my story's converted into this. I've just pulled a little green tree out of the big green tree. So my toxic tree has now become this tiny little green thing that makes me cry because it's sad, but I manage it now. I control it. I've now redesigned how it plays out into my future. But that takes time, takes work, takes effort, and it's hard. But you get there and your life never changes. Your life just is never the same again. You've got a level of growth in you that will help you through the next trauma. And that's how we're supposed to be growing through life.
Oh my gosh. Thank you so much. Tell everyone where they can follow you, find your book and your app.
Absolutely. Dr. Caroline Leaf is my social media handle. So Instagram, Facebook, at my webpage, drleaf.com. The book's available wherever books are sold, including my website. The app is available to iTunes and Google Play. And then I have a podcast called Cleaning Up Your Mental Mess. So lots of good advice on there.
I love it. Thank you so much, Dr. Leaf.
So thank you so much for inviting me to talk on your podcast.